Hey everyone, let's learn about the atherosclerosis. So, definition of atherosclerosis is it is characterized by intimal lesions called atheromas or atherosclerotic plaques and can rupture to cause sudden occlusion. So, here the atheromas or atherosclerotic plaques are present and these can rupture to cause sudden occlusion. Let me show you the diagram of the atherosclerotic plaque. So, this is the diagram. So, it contains firstly the endothelial cells, then the fibrous cap, which contains smooth muscle cells, macrophages, foam cell, lymphocytes, collagen, elastin, proteoglycans, and neovascularization occur here. Second is necrotic center. It contains cell debris, cholesterol crystals, foam cells, and calcium. And the third one is media. So this is the basic structure of atheromatous plaque. Now, the pathogenesis of atherosclerosis, very important. Response to injury hypothesis. So, in this model views atherosclerosis as a chronic inflammatory response of arterial wall to endothelial injury. So, it's a chronic inflammatory response to arterial wall to endothelial injury. So, let's see the pathogenesis. So, here we are having the endothelial cell injury leading to the endothelial cell dysfunction. Then there is accumulation of lipoprotein, especially it oxidizes LDL, and platelet adhesion and monocyte adhesion occurs. Then there is lipid accumulation within macrophages. So then smooth muscle cell recruitment, and further there will be the smooth muscle cell proliferation and ECM production. So morphology of atherosclerosis. So its fatty streaks are present, means lipid filled foamy macrophages. Lipid filled foamy macrophages are fatty streaks. Atherosclerotic plaque means intimal thickening plus lipid accumulation. Atherosclerotic plaque has three principal components: cells, especially smooth muscle cells, T cells, ECM, and intracellular and extracellular lipids. Now, atherosclerotic plaque on cross section appear eccentric. So, atherosclerotic on cross section it appears eccentric. Now, this is the diagram of the pathogenesis of the atherosclerosis. So this is endothelium, intima, media, and adventitia, the layers, and here we are having chronic endothelial injury because of hyperlipidemia, hypertension, smoking, homocysteine, hemodynamic factors are present, toxic viruses, and other immune reactions are present. Now, response to the injury, there will be the endothelial dysfunction. Mean example, there is increased permeability, leukocyte adhesion, monocyte adhesion, and migration will be there. So immune response होगा, response to injury होगी, तो what will happen is there will be the endothelial dysfunction, जिसकी वजह से platelets आएंगे, monocytes आएंगे, इनका addition होंगे. The next step will be the macrophage activation, smooth muscle cell recruitment, and accumulation of lipid in vessels. So this is the third step. Now fourth, here the fatty streaks are also present in the fourth step because macrophages and smooth muscle cells, they engulf the lipid. These yellow lines are the fatty streaks. And the fifth step is the smooth muscle proliferation, collagen and other extracellular deposition, matrix deposition, and extracellular lipid. So this is fibrofatty atheroma formed. This is lipid debris, collagen, and lymphocytes are also present. Now, so this one I'm marking it with yellow. This is fibrofatty atheroma. Major risk factors of atherosclerosis are the non-modifiable and modifiable. So, non-modifiable are constitutional. So, first is genetic abnormalities, family history, increasing age, and male gender is non-modifiable. But modifiable are hyperlipidemia, hypertension, cigarette smoking, diabetes, and inflammation. That was about the risk factors of atherosclerosis. Now, the clinicopathologic consequence of atherosclerosis: MI, cerebral infarction or stroke, aortic aneurysm, peripheral vascular disease, PVD. These are major clinical consequences of atherosclerosis. So, what is acute plaque change? So, it is the plaque region or rupture triggers thrombosis, partial or complete vascular obstruction, and often tissue infarction. This is called acute plaque change. Erosion होता है followed by the thrombosis. Now there is plaque inflammation, which increases the collagen degradation and it reduces collagen synthesis, and further it destabilizing the mechanical integrity of cap. So it destabilizes the mechanical integrity of fibrous cap. So here let's see the vulnerable plaque or the stable plaque. So firstly we'll learn about the stable plaque. Here the densely collagen are present. Collagen is dense while the thick fibrous cap. So this area you can see, this is fibrous cap and the one in yellow, this is lipid core. So it's having thick fibrous cap in the stable plaque, while the vulnerable plaque will be having more of the lipid core. Here the lipid is very less, you can see very less of yellow area, and here more of the area is the yellow, which is lipid core, and this little less fibrous cap. It's very small now with respect to stable plaque. Now the vulnerable plaques that contain large number of foam cells, abundant extracellular lipid, thin fibrous caps, few smooth muscle cells, and clusters of inflammatory cells. Here you can see these cells, these are inflammatory cells. And that was about the atherosclerosis.